Ladies and gentlemen, welcome to the CTA Foundation's 6th annual pitch competition for health tech. And now, please welcome Executive Director of the CTA Foundation, Steve Ewell.
Hello, CES 2024. I am thrilled to be back here this year and doing an amazing pitch competition. We have 8 incredible companies that we judged from. Honestly, there were dozens and dozens and dozens of companies that submitted. I think we could have been doing pitches all day long and had incredible companies pitching, but we've narrowed it down to 8 that you'll get a chance to hear from today. Just to introduce myself, my name's Steve Ewell. I'm the Executive Director of the Consumer Technology Association Foundation. We are the charitable foundation affiliated with CTA, the organization behind CES. And we're focused on how technology can improve the lives of older adults and people with disabilities. So you're going to hear a lot of incredible technologies today that have life-changing opportunities. I really want to thank the sponsors who helped make this event possible. We have the Next 50 out of Denver, Colorado, another foundation working in this space. We have Rico, an incredible supporter of our work. I want to thank Canon, who's back for the 2nd year supporting our work here. Then we have the Pittsburgh Regional Health Initiative through their Patient Safety Technology Challenge. They've actually added an additional award that you'll hear from one of the judges here shortly. But they were able to identify or look at the companies that are pitching here and in the way they can best address patient safety issues, and that is supported through the Jewish Healthcare Foundation, so we really appreciate all of their great support. We also have a couple additional prizes that are going to the winners in addition to the financial support that we'll be able to give the winners. BBC Storyworks was nice enough to offer for the grand prize winner. They will get a BBC Storyworks video created. If any of you have seen the Technology's Golden Age series that we partnered with them, or the CTA 100th anniversary video here at CES, you can see the incredible work that BBC Storyworks puts together. We also want to thank Established. Established will be doing interviews with the winners for the Startup of the Year podcast. So we've got a great way to see some incredible technologies and highlight the work that they're doing, and then give them a ton of great recognition coming out of this pitch. We have some incredible judges that are going to get introduced here shortly, but we're also looking for all of you to play a role in this. We want to see the audience choice. So we have an app called Slido. There's a site up here at slido.com/CTAF CES, so CTA Foundation CES. So if you pull that up on your phone, it's an opportunity. After each company pitches, you'll have the opportunity to vote. And then the company with the highest ratings at the end will win our Audience Choice Award. So we're really thrilled to hear from you, in addition to hearing from our incredible judges here today. I'm going to give this a little bit of a test. So if all of you do pull up that website, we want to hear a little bit about who all of you are. So there's going to be a first question that's going to pop up. And it's just going to ask, are you a startup company? Are you a more established company, an investor, someone in a nonprofit or service community? So if you just pull that up and answer that first question. So as we go through, essentially each company is going to have 3 minutes to do their pitch. There's going to be 2 minutes for our judges to ask a few questions of them. And then there'll be 1 minute for you all to vote in this Slido app. And so you'll essentially have a chance to give feedback as we bring the next company up. It's going to be fast moving. It's going to be great. All right, so hopefully all of you have had a chance to get through the Slido. Now, it's my real pleasure to introduce our MC for today. He is a good friend who I've had the opportunity to work with quite a bit at the CTA Foundation. He is a host for ABC Radio, KMET. He is the host of the Tech Zone podcast. He has just an entire media empire, I feel like. But please welcome my good friend, Paul Amadeus Lane.
Thank you. Thank you so much. Hello, how's everyone doing today? It is my honor to be with you. Let's give it up for the Executive Director of the Consumer Technology Association Foundation, Steve Ewell. It's my honor to be with everyone here today. A little bit more about myself too. I also work as an accessibility consultant. I work with the video gaming industry, work with PlayStation. I was even on the project Leonardo, which now is the access controller with PlayStation. I was on that project as well. But it's a pleasure to be with you, pleasure to be here. But let's introduce our wonderful experts that we have here. First up, we have Jeremy Brown. Jeremy is managing partner at CF Health Advisors, where he helps his clients navigate the complexities of healthcare landscape. He is also an investor and advisor to multiple entry-level healthcare technology companies and venture capitalist firms. Welcome, Jeremy. Our next expert is Shana Lawlor. We're so happy to have Shana with us. Shana is a digital health entrepreneur, consultant, venture capital investor, and managing partner at 2Rays and Total Point Capital. I'm sorry, I think I might have butchered that. I'm sorry. She is also a limited partner of Rock Health Capital and an investor with Health Tech Capital. We welcome you, Shana. And next up, we have Dr. Susan Malinowski. She goes by Mal. Mal is an accomplished surgeon, educator, inventor, patent holder, angel investor, and startup board advisor. She also seeks out synergies between function, technology, wellness, and beauty. We welcome you, Mal. All right. We also have with us Lance Baily. Let's welcome Lance. Lance is the founder and CEO of HealthySimulation.com, which provides the latest news on medical simulations, training, webinars, product demos, research updates, and more. He also founded SimGhost.org, which is a nonprofit organization that provides online resources and training events for healthcare professionals around the world. We welcome you, Lance. All right, so are you all ready to get this competition started? Are you sure? All right, well, let's do this. First up, we have our first startup with us. They are named AAVAA. They're joining us, and they're from Montreal. So they have 3 minutes to pitch their competition, so come on up.
Hi, my name is Naim. I'm founder and CTO of AAVAAA. We unlock superhuman capabilities. We empower paralyzed people to control their devices just using their eye and subtle gestures, like a simple blink, enhancing their autonomy. We enable people with hearing impairment superhuman hearing. We let them hear what they want in noisy environment just by focusing on them. We allow seamless wearable control, like answering a phone call with a simple wink. Our attention and intent tracking platform can be integrated in many head-worn devices, including AAVAAA devices. We provide an end-to-end solutions with innovations in many fronts of our technology, from biopotential sensors to hardware, design, neuro AI decoders, and acoustics. In just 2 years, we have miniaturized our hardware to 30 times smaller than its original size, while maintaining the same computational power and high accuracy. We have tested more than 500 individuals to design ergonomic devices that are optimized both for signal quality and comfort. We are the only global provider of biopotential sensors, both in fabric and 3D printed versions. Our target market is huge, starting with assistive technology and expanding to AR, VR, hearables, and IoT. Our business model is B2B, licensing to major manufacturers. At the moment, we are selling our development kits to engage and gauge their interest. And here are some of the interested partners so far. In just 4 years, we have had incredible achievements: device productions, patents, grants, and prestigious awards. We are now raising our seed round to produce 20 to 30,000 devices and partnering with companies in accessibility, resulting in $1 million revenue in April 2025. On Series A, we'll be completing our development and licensing, aiming for $50 million revenue by 2027. We are called AAVAA, a new way to experience the world. Please visit our booth to experience the power of this technology in action. Thank you very much.
Awesome. Let's give it up for AAVAA. Now it's time to vote. So please go to the website that's shown on the screen, slido.com, CTA, FCES to vote for AAVAA. Judges, also give me a thumbs up once you are done with your vote as well. Oh, judges, sorry, your question, sorry, sorry.
Can you tell me a little bit more about your go-to-market strategy? I saw a lot of customers or potential customers up there, but I'm just wondering how targeted that go-to-market strategy is.
Sure. We are already working with companies such as LG, Meta, Samsung, NASA. So there are multiple companies, also companies in accessibility. The biggest one is Tobii Dynavox. They are receiving our development kits, and we are selling them with a price of $20,000 to $50,000. Meanwhile, we are actually entering to the market B2C, and so many people with paralysis. So our low-hanging fruit is accessibility and working with people with paralysis, because the technology is ready. We have 95% accuracy is detecting their facial gestures such as blink. So the technology has been already working, and meanwhile we are trying to work on the licensing deal. So we got POC from multiple companies, and also we just showcased in collaboration with another company an AR glasses to Apple and Qualcomm. So we are working toward licensing this technology to all of these companies.
All right. No more questions from the judges? Okay. So now it's time to vote.
Thank you very much.
All
Thank you very much.
Go. Just give hands for AAVAA. Now you can go to the website shown on the screen. You have about a minute to vote, and judges, you can give me a thumbs up when you are done as well. So while we're waiting for that, how many here in the audience is here for the first time at CES? Wow, a lot of newcomers. Awesome, awesome. So are you guys enjoying what you see here at CES? Nice. Now, what's one bit of technology that you want to see here at CES? You can scream it out to me. Nice. Why that? Any other technologies? Any other technologies everybody want to see here at CES? Cars, TVs? Nice. I love that. I love that. So, judges, we're all good? Thumbs up? Thumbs up? All right. Mal and Shana, thumbs up? All good? Okay, sounds good. All right, so Let's bring up our second startup to the stage. All the way from San Francisco, California, we have Augmental. Let's welcome them to the stage.
Good to go? Thank you. Hello, everybody. I'm Corton Singer, co-founder of Augmental, where we create hands-free device control at the tip of your tongue. Now, since its invention in the 60s, the computer mouse hasn't really changed much, yet the hand-based input paradigm has dominated. And we really want to question this paradigm and embrace the idea of a more human computer interaction, particularly as we feel that the future will become more and more wearable. And as a first step towards this, we're focusing on an extreme case of just how limited hands-free options are today. Here is Keely. She wants to be a mechanical engineer, but her existing lip joystick device leaves a lot to be desired. She can't perform basic cursor functions like click and drag, and it creates an obvious physical barrier between her and the world, increasing social stigma. So this motivated us to create the MouthPad, smart mouthwear for hands-free device control that leverages the innate dexterity of the tongue, as well as head motion, breathing gestures, and speech as input. Good interfaces are going to be multimodal and human first, meeting us where we are at the level of input we find most suitable, not the other way around. And today, Keely uses her MouthPad for virtually all computer control, averaging up to 7 hours of daily usage, and she can now independently play games, raise her hand in class on Zoom, and even make CAD designs. And her family has told us that getting this MouthPad has been the single biggest life change for all of them since she developed quadriplegia. And beyond Keely, here are some of the other amazing champion testers that worked with us during our beta program. To date, we've received over 1,500 organic waitlist signups, and we ran a successful beta confirming that the value we can provide today is life-changing. We've also been able to communicate our story to global audiences, winning the Cannes Lion Grand Prix Award in Innovation in 2023. And today we are on the market, making our first sales to direct customers as well as to national institutions like the VA. We're starting by serving the 900,000 people living with quadriplegia in the United States, but we'll expand to adjacent hand impairment markets as well, such as severe stroke or more moderate repetitive strain injuries, capturing over 20 million people. And our current cost today is $1,000 for our early access customers. We do expect this price to increase, particularly as we unlock FDA certification and particularly medical reimbursement. Our product today is effectively reinventing the computer mouse, but for tomorrow, we also want to reinvent the keyboard by providing silent speech-to-text input like we've never seen before. We want to support voice when it's useful, but also enjoy tongue-based gestural interaction when voice doesn't work, though our end goal is to serve as a platform technology within the mouth. And a bit about our team, we've worked in hands-free interfaces for over a decade, exploring all the alternatives out there. This is a culmination of efforts, not just a lucky guess, and we have a very powerful team to back it up. And we're raising our seed round, just looking for a lead to close this off. So, if you are interested in this technology and you'd like to learn more about how we can truly change people's lives, shout out to my cousin Nico here, then please come see us at our booth, 6460, and see some live demos. Thank you.
Awesome. So any questions from our judges?
Thanks for showing it.
Yeah,
can you tell us a little bit more about how you charge this, how you clean it, since it is sitting in the mouth, and are there different sizes for maybe children or adults, that sort of thing?
Yeah, we charge the device similar to your AirPods. You put it into the charging case. It is fully encapsulated, so we have wireless charging so that it doesn't have to ever be broken open. As a result of that, it's fully encapsulated. All you really need to do is lightly wash it, maybe a little bit of soap, similar to how you might brush your teeth in the morning. We have yet to find any issues with hygiene in any of our early customers so far. And we do make custom devices that fit to everybody's individual mouth. We want this to fit naturally and comfortably and not impede your speech. So we want to get that custom dental model either through a dental impression where you bite and onto an impression and we scan that, or visiting a dental lab where you can get an intraoral scan to produce a digital dental model so that we have your custom file and it fits just perfectly.
So it's pretty clear the application for the quadriplegic market. What would be the next, what's the next one on your list that you'd look to go to? Are there other conditions? How are you exploring those?
Yeah, great question. Particularly as we've seen a lot of advancements with LLMs and chatbots, we're really excited about incorporating speech because we envision this future in which we have a dialogue with our AI assistants that are with us, and we can do bone conduction audio feedback as we have access to the rigid material of the upper jaw. So you can silently and privately speak to your AI system and have them speak back to you. This is one use case, but we also see a lot of awesome opportunities as the AR and VR industry matures, looking for new, novel ways to interact with your systems without the use of hands so that you can be more immersed in that experience.
Can you tell me a little bit more about your financial strategy? So it looks like you're self-pay and then you're going after some government contracts, or how's that working?
Yeah, we are doing direct-to-consumer sales at first, but even today we're selling to the VA, which pays for these devices so the customers don't feel that cost. We're also working with the Department of Rehab to reimburse non-medical tools. This is not a medical device at the moment, to enable your employability. But in the future, we do want FDA certification so that we can have insurance payers cover the costs for our users in what we think is really a life-changing use case.
Awesome. Thank you so much, Augmental.
Thank you.
Thank you, thank you, thank you. All right. You know what it's time for now, right? It's time to vote. So make sure you go to the site that's on the screen right there and vote for Augmental. That was a really great question, Mal, about how to clean it. Because I was thinking about that too. You have that in your mouth and it's like, okay, how long do I keep it in there for before I have to clean it? Really good, really good. So Jeremy, how many CESs have you been to?
My first.
First one? Wow, welcome. Welcome, welcome, welcome. Awesome. What about all the judges? How many times? 3 for you, 2 for you, Amal?
20.
20. So you must have started coming here and you were 2 years old then, right?
I love you.
Yes, 2 years old. Awesome. And it's amazing just the amount of technology that we see here, especially here at Eureka Park at the Venetian. It's really, really awesome. So judges, let me know whenever you're done and give me the thumbs up. All right. Well, let's go on to our next contestant, BeAware. We welcome them from Sterling Heights, Michigan. We welcome you to the stage.
Hello, everyone. How's it going? I'm Samir from BeAware. Our project our success would not have been possible without the help and passion of hundreds of users and volunteers. BeAware's first product in 2021 is the Deaf Assistant app. It is used by over 13,000 people who are deaf and hard of hearing in over 50 different countries, on average 4 times every single day. And it was also featured by Apple. There are over 1.5 billion people who are deaf or hard of hearing. Isn't that unbelievable? That's 1 person for every 3 households in every city, in every neighborhood. At one hospital system where we were fielding our technology, they had 1 million patient contacts with people who are deaf. Modern hospitals rely on major technology firms, but those firms are often slow in integrating newer innovations. And it's very hard to find certified, reliable translators who are available 24/7 for hospitals. And old age deafness and cognitive decline is almost totally ignored at hospitals and medical centers, often leading to misdiagnosis. My friend Adam is a doctor at a hospital in Michigan. One night he gets a patient who is deaf, and the go-to translator is not available because he's spending time with his family. Normally, there would be a chaos at the hospital, but luckily his hospital just approved HealthScribe. And within 10 seconds, doctors are able to treat their patients. This data is not stored anywhere. It doesn't use the internet. And within 30 seconds of no conversations, everything is wiped out, stored nowhere. Old age patients who suffer from deafness are particularly grateful because they used to be too shy to speak up whenever they couldn't hear the doctor, thus reducing errors in patient care. HealthScribe also provides live translations better than Google Translate because it works completely offline and it uses our custom language models. Last month, we won the Henry Ford Medical Center Innovation Challenge, and we are piloting this technology at their hospital system. To implement this technology, we align with their success metrics, we pilot this, and then we roll it out as a license fee. So in the future, we can also possibly provide suggestions to the doctor based on what symptoms the patient has. And then we can also provide possible differentials. We are the best team to solve this problem because we have the right leaders and the accomplished advisors. Sorry, the time just got over.
All right, it's time
Please,
for
please try BeAware. Scan the QR code to try a free trial of the BeAware app. Thank you.
All right, it's time for our judges' questions now.
Could you talk a little bit about how the licensing fee works? So it's $100 a month, but is that how does the usage get? Right, because like is Michigan, if it's the hospital in Michigan, are they just paying you $100 or they're paying it per usage? How does that?
Yeah, so it's $100 per device, but then to smaller doctors who want to implement it at their clinics, we also do a usage-based model. So it's like $7 per patient visit, and that way they don't have to pay the entire amount if they don't use it.
Thanks.
Great question.
So I saw on your website that the app is free and it's also open source. How does that work with your licensing fees and then some of the other agreements that you have?
Yeah, that's a great question. So the Deaf Assistant app that is free for usage, but then the HealthScribe app that is used by businesses is a paid app, but there is a free trial version for them to use. Great question. Thank you for checking the website.
So what is your go-to-market?
So we're aiming for hospitals. So all hospitals have an innovation center where they're either trying to sell their technology or look for technologies that are trying to implement new at hospitals. And so we're trying to aim for that, as well as for smaller clinics where doctors are trying to, for example, not learn Rosetta Stone, so that they can get to other patients as well. So, in Michigan, for example, there's a Polish population, so any doctor can be able to communicate with, multicultural patients. Thank you.
Quick question with regards to communication, so important in healthcare, and patient record keeping, so important. Have some clinical groups suggested that they would like to keep a record of the documentation for patient record keeping?
Yes, actually, I work with a doctor in Sterling Heights, and he wants to keep the records. And so we're going to be able to allow customizations where, at the end of the entire patient visit, he's able to copy it and just paste it into whatever tool that he uses. That's a great question. And then there's, like I mentioned, there's other possibilities as well, where using local language learning models. So not even using the internet, it can process the entire conversation and provide better notes for the doctor, and even like a follow-up email that he can review and then just send it out. Great
Awesome.
question. Yeah.
Let's give it up for BeAware.
Thank you. Appreciate it.
Well, you know what it's time for now, right? It's time to do what? Absolutely. So make sure you go to the website shown on the screen, slido.com/CTAFCES, to vote for BeAware. You got about a minute to vote, all right? Who want to play some CES trivia? Who wants to play that with me? You want to play that with me? CES trivia? Show of hands? Any show of hands? All right, cool. When was the first CES here in Las Vegas? 1987? 1977? 78? 67? Okay, we have 67, we have 78. So I think in the West Hall, it has like a mural of CES. And on there, I believe it said the first CES in Las Vegas was 1978. Awesome, so you won. Winner, winner, chicken dinner. Awesome. You win a life-size portrait of the executive director, Steve Ewell. That's priceless right there. I love it. All right, judges, we have our thumbs up. All right, so let's bring on our next competition to the stage. They are from Rocky Mountain High, Colorado. From Boulder, we have Earable. Let's welcome Earable to the stage.
Thank you. Thanks for the introduction. Good afternoon, everyone. It's a pleasure to be here to introduce our latest device that helps people to improve their sleep. A Frenz brain band that helps to unlock your brain potential. My name is Vu, the founder and CEO of Earable. And Earable is founded to commercialize a set of technology that I have developed at University of Colorado in Boulder and Oxford University in the UK, where I've been a professor there for about 10 years. So the core of the technology is the ability to help people to improve one of the very important foundation of this health, which is sleep, right? We all know that it's important, but we are facing the pandemic for sleep that more than 45% of people having sleep issue, and that number increased to 65% as you get older, about 50 years old. So what's missing on the market in the sleep right now is that a device that can help to improve your sleep. Obviously, you can find a lot of wearable devices and devices in hospital that can help to track your sleep, right? As a PSG or a phone or even a ring on your finger. But what Frenz providing is the device that can help to actually track precisely your sleep and then actively to improve your sleep. So how do we do that? The core of the technology is the ability to have the device to talk to you, to coach you into sleep that is personalized. And our study have done on more than 800 people and recently published in Nature's scientific report have shown that we can help people to improve their latency to sleep by 24 minutes. And the accuracy of us when we're tracking sleep is 88% compared to the gold standard device that you find in the hospital, which is a PSG device, right? So the core of our device is actually the 15 patent, internationalized patent that we have. And the core here is that it's really flexible and comfortable to wear. That is a bone conduction speakers on the two sides. And at the same time, it can capture your brain signal, your eye signal, your muscle signal, and many other information from your head so that it will know exactly what to talk to you, when to talk to you, and when not to talk to you, and applying cognitive behavior therapy and relaxation therapy to help you to fall asleep faster. So far we have so far we have sold the device on Amazon, and the price is $490, and it also comes with a subscription from $5 to $50 as a premium. So we manufacturing this device in Foxconn, and our capacity is 3,000 devices per month, and it's also available on Amazon and our direct-to-consumer on our website. We're currently being funded by Peter Thiel's Founders Fund for the last 3 rounds, and also heavily funded by Samsung in Korea. So what we are looking at is and also we have a B2B partners and a customer as a Regeneron, as a pharmaceutical company. So we will be raising the next round of funding in the second quarter of 2024. So we'd love to looking for partners, that distributor, and also the consumers, also the strategic investors. So thank you.
All right, let's get some questions from our judges, please.
So is this a device that's meant to sort of coach someone to sleep better and then eventually they move off of it, or is it a long-term intervention?
A great question. So it is a device that can coach you in real time so that it will help you to fall and sleep faster, sleep deeper, and wake up feeling refreshed. But it also helps you to change your sleep behavior and sleep habit so that you can have a long-lasting effect and long-lasting impact for the device. Yeah.
So what exactly is it telling you to do?
An example of this is, for me, for example, it would say, hey, lay down, relax. Think about, for example, think about a mountain far away. And basically, it really helps you to relax. And the key here is, because we have the advanced technology that can understand what's going on in your brain, so that you will know exactly how your brain is responding to what is coaching you. Let me as an example. So I play piano. When it's first talk to me, it start playing piano, and then my brain becomes really active. And it knows that. It say, piano is not right for Tam. So it switch to a different content, like natural sounds, rain, the sounds, and those would help me to calm down and sleep. And then since then, it will continuously play that kind of genre so that it helped me to fall and sleep better. And it has the bone conduction speakers here right above the ear, so that it will transmit the sound through your bone, so that it doesn't cause your ear does not get blocked.
And will it work if you don't have a subscription?
It does work if you don't have subscription. $490 is the current price, and it comes with the lifetime standard. With the subscription, you have a much richer library, and also you have access to a lot more services like the analytics of the data, and then the personalized coaching. Yeah.
Thank you.
Thanks.
What's your strategy for growth? So are you thinking of using this for a second market?
So currently, as I said, we are selling on Amazon right now, but we're also having go sell directly on our website. The second channel that we're currently going through is going through a sleep association, sleep clinics, talking to doctors who make the recommendation. But keep in mind that this current version is only a wellness device. And we will be, in 2025, we will be releasing the FDA-approved version of this, which is lighter, but it has a lot more restrictions in terms of certification. Currently, we have Ewell, we have CE mark, we have FCC mark, but not FDA. But it's going to be in 2025.
So for clarification,
awesome.
Sorry.
I'm sorry. Thank you so much, Earable. We really appreciate it. Thank you.
I'd love to take questions outside. Yeah. Thank you.
Yes,
Thanks, everyone.
Thank you.
And if you want to...
All right. You know what it's time to now? What is it time to do? Absolutely. So go to the website shown on the screen, slido.com/CTA-FCES, and place your votes for Earable. There's some really great questions that our judges have, and I was interested in the next question you were going to ask. If we had more time, I was like, wow, that's really awesome. You remember you got about a minute to vote? The one thing I love about CES is it kind of reminds me of sci-fi. How many sci-fi fans do we have in the house? Like science fiction, right? What would be a cool piece of technology from a sci-fi movie you wish we would have? What do you think? A Borg collective, a lightsaber? What do you think? Lightsaber? Yeah, I think lightsaber would be cool. But you know what would happen if somebody had a lightsaber and they were mad? It would be awful, wouldn't it? Especially get into a fight, like, yeah, definitely cut their arm off, right? Like, oh, and somebody will say, I'm your father, right? That's what they would say. Yeah. But it's awesome to see that we can dream about technology that we see in all the movies and all the tech. I would say, a tricorder would be nice, and even like an energizer, where you can transport, or you can go from state to state, and that would be pretty cool as well. So judges, just let me know whenever you have your scores, and then we can move on to a very special presentation. So before we move on to our next pitch, we want to take a moment to welcome back to the stage the Executive Director of the Consumer Technology Association Foundation, Steve Ewell, for a very special presentation. Come on down, Steve.
Thank you, Paul. We've had some incredible pitches so far, and I look forward to seeing the 4 more. It's hard to believe we're already halfway through. But before we do that, we wanted to, we have another presentation and award we wanted to do. And to set that up, I'm going to invite onto stage Denise Gibson, who is a board member of the CTA Foundation, past trustee, and essentially our award that we're going to be giving out here today is the Shalam Award. And Denise is incredibly close with John and Jane Shalam. John is the founding chair of our board. So I wanted to invite Denise here to talk a little bit about this award because we created it under your leadership as the chair.
Thank you so much, Steve. It's an honor to be here, and for sure an honor to be able to present the John and Jane Shalam Award. John started AudioVox back in 1960, and I'm sure many of you, if you're as old as I am anyway, are familiar with that brand. Over the years, the company name has changed to Vox. John, for decades, has attended the Consumer Electronics Show, literally decades. This is the first year amongst those decades that he was unable to come to the show. We were all pleased to celebrate his 90th birthday in December, and he would like nothing more than to be here and with Jane to present this award personally. So for me, a great honor to talk about the award and also have the opportunity to present the award. The award was created to recognize entities in the not-for-profit space that are addressing the needs and the purpose of the CTA Foundation, which is to address the isolation of individuals, particularly seniors and those with disabilities. Every year we are honoring one of those organizations because of their innovation, because of the number of people that they have touched and helped, and because of their messaging in terms of how they have gotten the word out in terms of options that are available to help individuals with social isolation. So having said that, it is my very, very great honor to present the 2024 John and Jane Shalam Award to Lighthouse Guild.
Lighthouse Guild has been an incredible grant recipient of ours over the years and uses technology to serve the needs of people with blind or low vision community and has done some incredible work addressing social isolation. So with us is Dr. Bryan Wolynski, who is their Chief Technology Officer, to accept this award.
Bryan, it's a great honor to provide this award to you again from Jane and John Shalam. Thank you and congratulations.
Sure, I just wanted to say thank you to John and Jane Shalam, and thank you very much to the CTA Foundation. It's incredible, it's an incredible honor. Lighthouse Guild provides exceptional services that inspire people who are blind or visually impaired to attain their goals. And we know that through technology, we could break down barriers and we can help people thrive in their communities by combating social isolation. So from everyone who works so hard each and every day at Lighthouse Guild, we're very thankful and appreciative for this recognition. So thank you.
All right, congratulations. Thank you so much. All right, and with that, we will turn it back over to Mr. Paul Amadeus Lane.
Thank you, Steve. Really appreciate that. All right, congratulations once again to Lighthouse Guild. Let's give them another round of applause. And let's give it up for John and Jane as well, too, for that marvelous award. 90 years old, John is. That's awesome, isn't it? That's definitely a milestone, definitely a milestone. All right, you ready to get back to our next pitch? Yeah. All right. Our next pitch comes all the way from Hague, Netherlands. Can you believe that? This company is EW2 Health. Let's welcome them to the stage.
Hello. Hi, guys. Hi, thanks for the introduction. And I'm really glad to be here as the youngest entrepreneur of the day. Right? So shall we start it? Okay, here we go. Hi, my name is Renato Romani. I'm a medical doctor, and let's talk about personalized health. So let's say in my clinic, I receive a patient with a terrible headache for a few days, not going to work, and a few vague symptoms. Well, we examine the guy, blood pressure is high, give some medicines. Okay, here it is. But we need some exams, we need some tests. Few days and few $100s later, we see the problem, right? Hypertension, high cholesterol, obesity. And this is today around 100 million people around the world with the same symptoms. Well, weight loss depends on the personalization. We know that it's not so simple. It's not like just diet. It's a lot of things that happen. Obesity is a complex situation. So we need to have data to personalize the program. And here is the problem. Obese people, 75% of them don't want to see the numbers on the scale, right? And they are not in the stage of change to really change. So here is two problems. One, they don't want to see the numbers whatsoever. Second, it is wrong. So this is a real case. Once a week, people step on the scale. Using our solution, we understand the natural weight fluctuation. I will explain about that. But we show the people, without numbers, that they are in the right track. That's it. Simple, right? So that's what we are creating. So we developed the first behavior-based predictive analytics. So Sync, our solution, learns the weight fluctuation patterns to predict the future weight trend. So it's not about numbers anymore in the scale. It's about your future. You know the feeling when you step on the scale, first thing that you remember is the less weight, right? And you take everything that you can out for step on the scale, right? When you use our monitor, you see the future, and the future is bright. So every element, everything can change the pattern of the fluctuation. So it's a behavior base. We transform behavior in data. And this is about the professionals, the weight loss programs. So they are able to offer a personalized support during the weight loss journey without the frustration and anxiety of the weight. Now, this is really cool. Come on, this is awesome. I love it. Sorry, I got excited about what I created. So look, this is a really nice weight loss program in Brazil. They have 50% weight loss after 6-month program. And they use our tool. As they use our tool, people are willing to step frequently on the scale. At that point, we saw a better adherence, 89%, and increased weight loss. So we make, by far, more people lose weight.
All right, well, it's time to...
Okay, I will just take, because the questions will be a bit...
questions from the judges now.
Yeah, sorry about that.
So you were just about to talk about the cost and how this runs. Could you talk more about that?
Sorry?
In terms of the cost and you were talking about a fee.
So what happened is the professionals have a reduced management time, right? So it's cheaper for them to use our tool and in overall program. So we increase the client lifetime value. So they are willing to pay a fee for us to have the tool. The tool costs around $25 the monitor, and then they have a monthly fee that they pay for us to use our solution.
Can you talk about how much time using your tool a doctor would spend reviewing, evaluating?
Yeah, so we changed the game. That's the beauty. So people go to the clinic, they do the examinations, prescribe the diet, for example, go to the home. As people are using the solution and they step 3.8 times a week, so it's by far more, the professional has data. And that is the beautiful part. What we sell is the reports to be proactive. So they send a message once or twice a month, and the adherence goes up. So we really reduce the time management, and we really reduce what we did. We increased the efficiency of the program. We make the ROI clear for weight loss programs. I got excited. Sorry, I talked too much. I know. Sorry about that.
So the popularity of weight loss drugs is undeniable, and I'm just wondering, do you see your product as a companion to that, or a competitor?
No. We focus on the B2B2C, right? So the professional has a huge impact. I remember a client telling me, "Oh, Renato, every time that I step on your monitor, I remember you. So I eat more fruits." Well done. The guy lost 20 kilos. So this is what we do. We help them to create a real and anti-stress, let's say, stress-free monitor program. So they now are offering virtual programs. They can scale their business, and that's what we do. With science, with data, the first data-driven weight loss program is possible.
All right.
Right?
Let's give it up for EW2 Health.
Thank you, guys.
All right. All right, everyone. I'm sounding like a broken record now. It's time to do what? Absolutely. So please go to the website shown on the screen, slido.com/CTA FCES to vote for EW2 Health. Again, some fantastic questions from our judges. I was really intrigued with that, and I'll give you one guess why. I have a weight problem, so I was like, I can see myself in the future with a body like LeBron James, but with a bank account like the Kool-Aid man. So I was like, boy, the future looks bright for me. Anything that comes to health, I am definitely for it. So remember, you got less than a minute to vote. You can go ahead and do that, please. And judges, please give me a thumbs up whenever everyone is ready, and we'll be ready for our next pitch. Now we're going to welcome to the stage Proxie Health, all the way from Monroe, New York. Let's welcome them to the stage.
All right, all right. I'm trying to resist my Shark Tank self. I'm trying to hold that back as much as I can. All right, let's go. So Proxie is essentially the clearest, smartest, safest way to manage care in place for providers and for payers and families. So let's look at where we are. Right now, we're moving towards, by 2035, there'll be more seniors in this population than children. I'm not sure that we all kind of know that, but it was a big revelation to me. And what that means is that it's going to impact an entire ecosystem, which we call a care value chain. So not just families, but also providers and payers. On the sort of cost side, we're looking at close to $80 billion a year being spent, actually wasted, on care coordination. And this is something that we look to address. Across the entire spectrum, outside of just families, when you look at payers as well as providers, what we think the biggest issue is a lack of visibility and a lack of connectivity, which we call care blindness. And that's essentially the problem that Proxie is designed to solve. So it's a holistic approach is what we think is missing, and where we think that we can make the biggest difference in terms of how do we add visibility to where we exist most, which is outside of the home. So Proxie combines human expertise and AI to deliver value across that entire value chain. It has three main components. There's Proxie Care Navigators, which are humans, a care coaching content dimension for caregivers and for caregivers and care recipients, and then a machine intelligence layer, which is crunching data from 23 different aspects of care across 3 different dimensions: medical, behavioral, and social. And this is kind of just a small overview of kind of what it entails. So how Proxie works, we basically work with providers. We start with the provider EMR, and we basically get candidates there. Then we actually speak to those candidates, invite them to Proxie, do an intake, understand their care context, and then basically recommend in-home tech that can be used, off-the-shelf tech that can be used to actually pull data in terms of what's going on in the home. And then we basically take that data, analyze it, feed it to the actual doctor's EMR, providing insights, and also feedback to the family, the permission family that's part of the system. So we use a collective intelligence model, which kind of starts with the provider information at the very beginning, in terms of at-home care plan, what they recommend. We pull in OpenAI API data, large language model data, which is available today, and then we actually add data from the devices. And then we have a dimension in terms of human expertise on top. So basically what we see is a world where with health plans, we can actually increase visibility in terms of what's going on in the home, because right now that's a black box. We see a world where we can help providers, which is our initial go-to-market. It's going to be with doctors as a chronic care management solution and remote patient monitoring for doctors who don't have the staff or don't have the knowledge to actually provide that solution. And then also the families end up becoming a end beneficiary, as this is paid by Medicare, so there's no cost to the families. But there is a private pay dimension if families want more support than what Medicare will reimburse for.
Also, it's time now for our questions from our judges.
Thank you. Thanks.
So it's obviously it's up there now, but I was going to ask you sort of your journey, how you got here to do this, why this, you know,
Yeah.
sort of your
Yeah,
story,
yeah.
if you will.
Yeah. So my background's in design, so I'm a product designer, experience designer, and that's kind of where I came from. My wife lost both her parents, one after the other. We experienced that. I lost my parents, one after the other, experienced that. And I was like, yeah, this is a little crazy in terms of how this works. And so then I just kind of got to work there, pulled in a bunch of friends that are in the space, and happy to have as my co-founders, and that are in the patient navigation space, and kind of that's how we got here. Yeah.
Could you talk to us a little bit more about how family members would be able to access and utilize this app for the care of, say, elderly parents or children or just other family members? What are they able to participate in and engage with through the tool themselves as non-patient but family related?
Yeah, so basically the name of the service kind of came from that solution. So Proxie is designed for you and me, not for our parents, right? Because a lot of solutions kind of have, elderlies kind of trying to activate and engage with apps and so forth. It's for the permissioned person, the healthcare surrogate, the healthcare proxy. That's kind of who we designed it for. So it's that permissioned person that we pull in that actually helps with adherence, helps with like understanding what's going on, sharing it back to us. So we kind of made Proxie for them first, and then the sort of care recipient secondarily. Yeah.
So what's your go-to-market or sales strategy?
Yeah. So we actually are going to market in Q2. We're starting with providers. We're going as a chronic care management solution, which is reimbursable by Medicare if you have 2 or more chronic care management conditions. So we're starting there. It's about 200 doctor practices is kind of where we're starting and scaling. And then from there, we're basically trying to pull in enough real world evidence to start working with regional plans first, which actually don't have a lot of the infrastructure that some of the larger health plans have. And then, build that and then move into larger plans after that. But it's really going to be a provider, ACO, MCO, IPA, like that. That's really our first layer of kind of really helping to augment what providers do today. Yeah.
All right, our time is up. We'd like to thank Proxie.
Okay, thank you.
Really appreciate it. Thank you. Proxie Health. Let's give them a round of applause. All right, everyone, it's time to vote. So go to the website shown on the screen, slido.com/CTAFCES to vote for Proxie Health. Wow, time goes by so fast up here. They have 3 minutes to pitch their company, and it seems like as soon as they get into it, it's time to stop. I feel like the Sandman at the Apollo. We'll have to pull them off the stage. I feel bad for it because they have some really good information about their technology. Is really, really awesome. This has to be the coldest it's ever been in Nevada. I come to Las Vegas a lot. It has never been this cold. Do you remember has this been cold for you here too as well? I've never had to wear a jacket like to wear a jacket now. Turn the heater on in my car, especially if you go downstairs where the doors are open. It feels like it's like a -10 degrees. It is so cold. But I guess ones from back east are telling me to quit crying, right? Because this is not cold, right? This is like, yeah. So judges, if you can give me a thumbs up whenever we're done. Awesome. All right. You ready to take a trip now? We're going to go to Switzerland now. We're going to go to Neuchâtel, Switzerland, and welcome our next pitch to the stage. It's Senbiosys. Let's welcome them to the stage.
Thank you. My name is Asim from Senbiosys. We're based in Switzerland, Neuchâtel. I would like to share with you the stories of Emily, Amber, and John. John is concerned with his hypertension issues. Emily is navigating menopause, and Amber would like to explore her sleep patterns. They all want to step up their health awareness, and they want to go for a wearable health monitoring device. But They all heard about these smartwatches and connected wristbands. But John won't trade his mechanical watch for anything. Amber, and Amber and Emily, they find smartwatches and connected devices not the best with their outfit, and also too cumbersome for sleep monitoring. They all heard about the fact that the finger is the best body location also for health monitoring. So they want to go for a smart ring. But smart rings of today are too cumbersome. So for Emily, she has regular female fingers. It's really masculine design, the current smart rings. For John, he wants to monitor blood pressure, but current smart rings do not monitor blood pressure, and the quality of PPG signal that they deliver is not enough for this application. Amber, she has inflating fingers. She wants to wear the ring loose, and current smart rings, when they rotate, they lose track of health metrics. All of their needs are met by a single device, BeAware Smart Ring. So it's a true jewelry outside, crafted from titanium, medical grade titanium, and packed with Swiss precision and quality design. The core of BeAware is our groundbreaking PPG technology. You're all aware of the Apple Watch. In the back of the Apple Watch, you have this circular area here that tracks your vitals via what we call PPG, photoplethysmography. We managed to pack all of this into a single tiny chip. That's what we have invented at the Swiss Federal Institute of Technology, brought spun off from the university and brought to mass production. So this is fully de-risked technology. This change of paradigm in PPG technology is what takes us from the smart ring of today to the smart ring of tomorrow, BeAware Smart Ring. Notice the width difference. On this market, each time the width has been divided by 2, the market size has been multiplied by 10. Today's market of smart rings worth 3 million units a year. This is going to turn into 30 million units a year thanks to this sleek design. BeAware is not only sleek, but it's also smarter. It has 6 of our innovative PPG sensors all around the finger. Forget about the loss of signal when the smart ring rotates.
All right. Now it's time for some questions from our judges now. Time's up. Sorry about that.
So I'm wondering, how does the ring behave in different environments? In other words, if you're getting it wet, like swimming, and also things like skin pigmentation, how does that affect the efficacy?
So the smart ring is waterproof, and we are aiming for 100-meter waterproofness. Also, regarding the skin pigmentation, the outside is made of medical grade titanium, the same used in medical implants. The inside is made with biocompatible plastic. So no worries on that respect.
No, what I was wondering is, because it uses LEDs, how does the skin pigmentation affect the efficacy?
So, yes, the skin tone. The skin tone has an effect when it comes to the wrist. That's an issue that smart watches have. When it comes to the finger, the skin tone or the melanin plays a less important role. And thanks to the fact that we use the finger, we can get above this issue. We have also performed studies with a panel of skin tones going from, on a scale of 8, going from 1 to 8. And with all of them, we can manage to have good PPG signal quality, enough for vital monitoring. Yes.
Are there other markers that you're looking at besides stress, hypertension, sleep? And then also, do you have the ability to turn those off? And the reason I'm one of those people where the more I track my sleep, the worse my sleep gets. Then I get anxious because I'm like tracking my sleep. So do you have the ability to like turn that off, or?
Yes.
Yeah.
Actually, the philosophy behind BeAware Smart Ring is the following. We want it to be discreet outside and also discreet on the daily life basis. So this is a prevention device. For hypertension, the objective is not to give absolute value of blood pressure. The objective is that the sensor is tracking data. Our server is processing the data and looking from night to night if there is, for example, an increase or a decrease. If there is a substantial increase throughout months, for instance, you're going to have a message on your app the moment you want that tells you that there is probably an issue with your habits, with your daily routine that leads to a potential hypertension issue. Same goes with sleep. We monitor, and in case of issue, then you see. Of course, you can turn on or off all the vitals and look only on the ones you'd like. Philosophy is not to pop up messages all the time. We also hate that. Yeah.
All right, our time is up. We thank Senbiosys.
We are at the Swiss Tech Eureka Park, and we are fundraising. So if any interest, we will be there for you. Thank you very much.
All right. I ain't mad at him shooting this shot. Got to do it, right? All right. Well, it's time to vote. So if you can go to the website shown on the screen, slido.com/CTAFCES to vote for Senbiosys. Got about a minute to do so. Now I have a question to the audience. I'm a chocolate lover. Are you a chocolate lover? Is there a difference between Swiss chocolate and American chocolate? Is there a difference? Is there a difference in taste? It really is? I've heard that before, but I've never had Swiss chocolate. So let's do something. The next time you travel to Switzerland, we'll exchange information and you can send me some because I definitely want to try it. They said it's like no other, and I want to experience it. They said it's totally different than what we get here in the States, but I definitely want to try it. Can you believe that we are at the final startup pitch of this competition? Can you believe that? Time has flown by, hasn't it? And our judges have been amazing with the questions, and also the pitch competitors as well have been awesome too. So we're going to welcome our final startup pitch, Splendo Health. They are from Wassenaar, Netherlands. We welcome you to the stage, Splendo Health.
Thank you. Thank you for the introduction. My name is Jeroen Molinger. I'm the Chief Science Officer of Splendo, a Duke startup. Elderly are known for their post-operative complications. Interesting is what does and what defines the phenotype of risk of an elderly to have such complications. That specific phenotype is known. The biomarker, the integrative biomarker that really defines that risk is already known for 3 decades. And that is called CRF, cardiorespiratory function. Integrative biomarker that defines how the lungs, the hearts, and the muscle work together under a high metabolic stress, which is normally done in an exercise test in a lab. This is also the only biomarker that is an all-cause predictor of mortality and cardiovascular events in men and women. So, if you're looking at the elderly, how does we define the elderly as being high or low risk? Being sarcopenic, having a low muscle mass, or being frail, have a low physiological reserve. What they are combining is their low CRF number, right? So how can we make this work? Why is it so important for us to have the CRF number being assessed? Currently in the US, 9.2 surgical procedures are done with every American. 80% of those 9.2 surgeries are done at the age of 60 and above. That's a lot of surgeries with a potential of a population of high risk. The way that we currently do the risk assessments is kind of doing a questionnaire or eyeballing a patient. We see that eyeballing a patient in itself is very subjective. We overestimate patients pretty heavily, almost 33%, which we think they have potentially no risk, but they end up being high risk and eventually having a lot of complications, high length of stay in the ICU, high length of stay in the wards and on the floor, and potentially also have a high readmission risk. This is the old school approach. In the lab, a lot of logistics involved, not scalable. So what we do right now here at Splendo, we want to introduce a point of care assessment that can be done inpatient and outpatient in the clinic in a time frame of 20 or 30 minutes to have the full CRF assessment done, where we're really measuring directly the CRF of that patient, and that defines the risk of operations. So how does it work? We validated at Duke 2 different modalities of exercise testing. A 6-minute incremental step test and a 1-minute allow test with the use of 3 different sensors. One mask is a metabolic card with measuring V2 kinetics, 1 heart rate sensor, and one sensor on the muscle that measures muscle saturation, a kind of a proxy of how much muscle is really limited during that specific test. This is all done with the use of an app that's fully integrated in the SOP. So a assist that the nurse assistant can do this full assessment. We have data collection and data quality control on the fly and direct reporting after the test is done.
All right, it's now time for questions from our judges.
So can you tell me about your go-to-market strategy?
Sorry, again?
Your go-to-market strategy?
Yes, so right now we are looking for to be clinically validated and also FDA approved. We have a different metabolic card, which we are making ourselves and being FDA approved in the end of 2024. There is already a CPT code for it, there is reimbursements for it, there's already old school assessment, only we make it far more easier, far more less time consuming, and logistics are almost none. Yeah.
So outside of the assessment, right, which is sort of the market you're talking about, is there an ability to use this on a more longitudinal basis, like to coach people?
Oh no, absolutely, because currently in the preoperative space, we do only kind of a baseline risk profiling, right? This you can do in the whole patient journey itself. Because it defines your risk moving forward, but also potentially you can use it for tailoring optimizations. How do you nutrition? How do you exercise? How do you rehab? Yeah.
What's your distribution strategy?
We are a SaaS model predominantly, so we have sales still throughout the US. Currently only in the research space, not as much in the clinical space. Concierge medicine is really ramping up. They really love this metric as a definition of longevity and in the anti-aging market. So we are still very small, yeah, and we're still looking for a late seed Series A.
The data that's provided, is it giving you like an assessment, like on a scale of 1 to 5, your risk is very high or very low?
Absolutely.
Is that how it does it?
Yeah. You get a percentile specifically based on a cohort of 122,000 subjects that were assessed. So you have a very well definition in how far or what specifically risk you are. Yeah.
All right, let's give it up for Splendo Health. Thank you so much. Well, everyone, this is your last time to do what? Absolutely. So go to the website that's on the screen and vote for Splendo Health. This competition has went by so fast, hasn't it? And we once again like to thank everyone involved. This ends the startup presentation. So now we're going to give a round of applause to a job well done to everyone. Let's give a round of applause. And also make sure you vote for Splendo Health. Now, the judges now, they have a very hard job now. They are getting ready to deliberate. And we want to thank them for their expertise and their wonderful questions. Many questions that you had that we as consumers, we as fans had no idea should be asked, and we thank you all for that. Now, while the judges are deliberating, we're going to have a health and tech panel discussion lined up for you. Now, they're getting ready to set the stage up, so I'll be up here a few more minutes while we're setting the stage. How many of us here like streaming old content on our Fire TV, on our Roku? Watch old shows. Any of us like to watch old shows? All right, all right. What's your favorite old show? Grey's Anatomy. All right, all right. You know my favorite, what about yours? Frasier. All right, all right. Any others? Your favorite old show to stream? Any other takers out there? Frenz. Okay. Seinfeld. Okay. Mine is Taxi. How many of us remember the old show Taxi, right? My favorite episode was when Reverend Jim was going to get his license, remember? And he was at the DMV. So he didn't know the answer to the question. And what did he say? He said, "What does a yellow light mean," right? And then remember, Bobby said, "Slow down." So Jim said, "What does a yellow light mean?" He said, Jim, it means to slow down. So Jim said, what? He looks down at his paper. Does a yellow light mean? So great, great old shows. I love them. And I'm glad you love streaming old content as well, too. Well, now it's time for our panel discussion. We're going to welcome the amazing Nikki Omer, who is the creative director and program partnerships at BBC Studios, to the stage.
Hi, everyone. It's so amazing to be here. I'm always really, really impressed when I'm in a room with people doing such incredible things, having the purpose of coming up with an innovation that can dramatically improve people's lives. I mean, I work in media and don't do anything like that, but what I do get to do is actually tell these people's stories. I love a passionate founder. It makes for such powerful storytelling. And the winner, of course, of this competition will be making a film with us. And often what we find is founders and their work comes from quite personal stories. So we draw these out as much as possible. You know, storytelling, if you're a company, storytelling is so important and it can be hard to get right. And for us, there are a few sort of simple rules. When I'm telling a story, emotion is everything. So I'm doing everything I can to try and draw that out because you want people to feel something. I think you've got around 2 seconds to engage someone and then you've got to keep them. And, you know, in a world where we're served so much information, that is really, really tricky. So, you know, there are many, many tools to do that. And a very personal human story is a good way of doing that. But it's also about the small details, things like, you know, natural sound, scene setting, anything we can do to kind of put that person that we're talking about into a place where the viewer feels connected to them. Use of natural sound to help with the pace and tell the story. Is also really, really important too. So I'm really delighted to see who we'll be working with today, and we'll find out very, very soon. But also we have some other people on the stage, 2 of our brilliant sponsors. Let's say Rory from Rico and Peter from Next 50. Welcome. I'd love to get a bit of feedback about some of the pictures today. What do you think?
So I thought it was really interesting that they were, a lot of them were focused on data. Rico is an integrator of data, and I often talk to hospital systems about the fact that so much of their data gets stuck or locked and trapped in places where they can't have access to that. So one of the things that we work on is how do we convert that data into information? And it was great to hear them talk about the power of information and how they can take that data and create these tremendous technologies for generations to use.
How about you?
Well, Next 50 is a private foundation that's focused on funding and aging, and what struck me about today's pitches was it really is about cost reduction. And for us at Next 50, we recognize that it's really expensive to get old in this country. And so what can we do to create economic opportunity? And one of the things that we do is invest in technologies through grant making and impact investing.
So tell us about some of the projects that you're working on, the things that you're most excited about.
So when it comes to Next 50, we're looking at 3 key priority areas that we support. One is ending ageism. Another is aging in place. And finally, it's advancing digital equity. So some of our projects, our grant-making projects, for example, involve training older adults, involve supporting infrastructure development to get broadband out into rural communities. And some of our impact investing work is investing in venture to support health tech startups.
How do you end ageism?
It starts with you and me. It starts with us not joking about our age and the fact that we're alive and that we're getting around the planet a few more times. So it starts with each of us. And then it's little things like changing our words, changing our habits, being proud of the fact that we are living and aging. That's the start. It starts with us.
And I guess it's also about literacy as well, tech literacy. because that is currently a problem with older populations. And how do we make sure that it's not going to be like that?
So it's overcoming our own bias. If you go upstairs, you see there are AARP is putting on a massive age tech collaborative, and it just shows you the growth and the trajectory of this consumer, of this older adult consumer, that candidly I want to see more of, because when I turn 80, I want to be able to take care of myself.
Yeah, getting older is an absolute privilege. That's the way we all need to see it. Rory, can you tell me what Rico's doing in the health tech space? A bit more detail.
Sure. As I mentioned before, we're really focused on the power of the information that our customers are dealing with. We've got 3,200, 3,300 healthcare systems we work with today, and we see time and time again there's great initiatives going on with technology. There's tremendous advancements going on in how do we help people live longer? How do we understand aging in place? The challenge we have is how do we get our hands on the information so that we can reduce costs? I think the U.S. today is 60% of their expense is administrative, right? How do we reduce that expense? How do we take that information and really put it in the hands of professionals that can do something with that information? And the biggest piece is how do we then communicate with the consumer? And the only way we can do that is to have access to information that's accurate, that's timely, and also is where we need it. You think about how health systems today, a lot of our patient information is transferred via fax. That's 80-year-old technology. So to your point, how do we take technology for the sake of advancement, not just for the sake of, I've got a new cool technology?
Just thinking about health systems and the aging population, and am I right in thinking that by 2050, the number of people over 60 is going to double, I think, globally, something like that? And what kind of, there's obviously going to be, potentially, there could be a big burden on health systems. Do you think that you can make some changes at scale with what you're doing?
Yeah, the big challenge we have today is really the adoption of technology to solve the challenges we have today. The problem with health systems today, there's not tremendous incentives for them to be able to do that. The last big incentive we had, at least from the federal government, was the use of an EHR, and that technology is now 11 years, 12 years in use. What is the next technology that we're going to have the kind of movement that we had moving to an electronic health record? What is that next technology that's really going to speak to how do we help people age in place? How do we help people, the boomers that want to stay home and utilize the health system? So is it remote patient monitoring? Is it the use of a concierge type of medicine? But again, that comes with how do we monitor that information, and how do we give everybody access to the information? We had some great ideas today about how do we bring the community of health care to the patient, meaning their spouse, their children, their provider. How do we create that community where everybody has a part in that aging in place or that process as people get older?
There seem to be so many ideas around, and lots of small startups, and some of which we've seen today. How important is it, Peter, to invest in these small businesses, people, with a good idea?
It's critically important, and I think those startups that are really looking at the ecosystem of healthcare are the ones that are going to succeed. And specifically, I think it's those startups who are working with older adults in community. And what I mean by that is not just the healthcare systems, but those older adults who also rely on community-based organizations, the nonprofits, who deliver services that in some cases takes the place of the healthcare system because it may not exist in their rural community or in a low-income community. And so I think the most successful startups that should be invested in are those that are looking at not just consumers or not just healthcare systems, but the $2 trillion nonprofit marketplace as well.
Wow. This is a big question, a bit of future gazing, but what do you both think of what things are going to look like in 2050. And let's say we've made the right investment and the right technology. What will things look like?
Well, I look at this from my perspective because candidly, I'm in the field of aging for selfish reasons. When I'm 80, I want to be able to stay at home, age in place with technologies that help me and are affordable. And so I am optimistic at the trends, but we need a little more effort, a little more work in affordability and making it accessible to everybody.
Rory, any thoughts?
Yeah, I think when you look at technology and the future generations are going to benefit so greatly from this technology that we're creating today. I mean, you look at some of the things, you go to a children's hospital today where they've got babies that are born and thrive that are born less than a pound, right? You have people that have tremendous health challenges with their cardiovascular system that 10 years ago wouldn't be alive today. So I think when you look at the future, the technology is certainly creating I would say the infrastructure we have today certainly can support the objective that people have that I want to age in place, or I don't want to go through what maybe my parents went through, which was I have to go to a nursing home, or I have to burden my family member because the tools just weren't there. I mean, you look at since the pandemic, things like remote patient monitoring, and you look at things like telemedicine. I mean, right now we're reaching populations that we never reached before just in the last 3 years because all of a sudden now a hospital system can be reimbursed for that telemedicine visit. That's going to change the dynamic tremendously as we can reach out into communities that once were either underserved or not getting service at all, right?
Which area do you think needs the most investment then? Is it those underserved communities or a particular area of healthcare?
Yeah, we need to start with making sure that everyone has access to healthcare, and that means being much more intentional about getting into communities that have historically been marginalized. So I think about communities of color, LGBT communities, places where the healthcare system doesn't create enough flexibility to address their unique issues, and so we need to invest in that kind of capacity to make sure that everyone is cared for.
Yeah, I was just, believe it or not, I was on with a colleague the other day, and they've got work with the Cleveland Clinic, and they asked me to speak on a panel, and they were talking about the fact that in Cleveland, a very large portion of their population doesn't have access to the internet. Well, when you think about today, how am I accessing my provider? It's through an app, or they're texting me, or they're sending me something on my phone. And you think about a whole population in a very large city in Ohio that doesn't have any access to internet. I think so the investment in technology has to come also with the infrastructure investment.
How do you do that?
Well, recently the federal government has rolled out major investments in broadband infrastructure, and the dollars from ARPA funds, as some of you are aware, are now beginning to roll out. So for the first time in a long time, you have government-driven investments in broadband deployment in rural areas, like in Colorado, and frontier areas in Colorado. It's very exciting, and we have to make sure that everyone who needs access to the internet has it.
I'd love to know if you've got a favorite piece of health tech. If you do, could you tell me what it is?
Yeah, for me, it's the whole wearable market of, as one of the gentlemen were talking about, the rings, the technology for your sleep. To me, that's the fascinating field because again, it's educating us on what good health looks like, right? I think a lot of people grew up in an environment where you didn't know, what does my blood pressure mean, or what does it mean that I'm not sleeping consistently? Why would that matter? But once you've got the data and you've got something that's measuring that on a constant basis, I mean, you've seen apps like Lose It and some of these other health apps that'll help you count calories. The numbers are astounding that if you just get get a person to understand what's their calorie intake versus their burn every day, and they understand it's a simple math problem, it's amazing how fast somebody's health can turn around once they understand just the simple information of how do I get better, right?
Yeah, and for me, walking around the show floor, I find the most unobtrusive tech to be the most exciting. So to your point, wearables, I have one on now, and I enjoy it. It changes behavior. I don't use all the data, but it's enough to get me to sleep better. And I think the other exciting element to this are major consumer product companies that are just tweaking their existing product ever so slightly to make it more accessible and age inclusive. For example, I was upstairs and I saw Kohler has these fabulous shower systems that include delivery of scents and fragrances and sounds now. And you can imagine the sort of healing, the holistic opportunities that exist through just those sorts of subtle changes.
Amazing. And is that the ring? You're wearing a ring. That's your piece of tech. What does it tell you?
So it tells me when I wake up why I didn't sleep well. So my heart rate will have been fluctuated, or it reminds me to exercise more. And over time, I see trends and I sort of pay attention to those trends and adjust accordingly. I find it very useful.
And I suppose health tech is, a lot of it is about prevention, isn't it? And kind of like early intervention and I guess sort of trying to ensure that you're not getting health problems in the first place. But alongside that, does there need to be a slight adjustment within the health industry?
Well, yeah, I think a lot of it is education, right? The unfortunate part about the way that U.S. medicine has evolved, it's reactive and not preventive. And I think the equation now with the wearables, the rings, and all of the data that you can get, the apps that you can use, the simple free apps, it's the other side of the equation. It's the consumer of healthcare now being educated, which certainly every physician that I know, they struggle with how do I get somebody to understand the impact of being overweight or not eating the right things or not sleeping enough. Once the consumer, as we're seeing today, uses these simple technologies, I think that's when the equation starts to change. So they know that there's a way to improve the quality of their life.
Yeah, and I think there's an opportunity to revisit science, revisit studies that may otherwise be sort of dusty and on the shelves. So I think about a product I just saw where it was determined and it's demonstrated that subtle eye movements are an indicator of dementia and potentially Parkinson's. And for the longest time, you go to an eye doctor and we don't use the latest technology in our ophthalmology. And so there's this wonderful product that we learned about that is a VR headset that tracks very subtle eye movement that could help indicate and help diagnose Parkinson's. So I would encourage startups and founders to look at research that's sitting on the shelves and now apply it to new technology.
Amazing. I think, Steve, are we ready? We are. Amazing. Thank you so much.
Thank you.
Thank you.
It's been a pleasure.
Thank you very much.
Thank you.
Actually, I'm going to actually have the three of you stay up here with me. I'm going to invite a couple of our sponsors back on stage as well. So if representatives from Ricoh, Next 50, or Canon, if you'd like to join, you're welcome. And we are going to make some announcements. I'd also like to invite our judges back on stage. All right, come on up. All right, we got everyone up here. All right, we got quite a crowd up here, so we'll spread out a little bit. I want to thank everyone once again who is up here. Please give a hand for our incredible judges here. And once again, thank you so much to Rico, Next 50, and Patient Safety Technology Challenge and Canon for your support of this event. And with that, it's time for the big announcements. All right, first up, we're going to announce the Patient Safety Technology Challenge, and I'll give the mic here to Lance.
Thank you so much. So we're so excited for the support from the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative for supporting the Patient Safety Technology Challenge today. Just a really important note that outside of COVID years, medical error is the third leading cause of death in the United States. So there's a lot that can be done there to improve patient safety, reduce medical error. And in fact, the OECD suggests up to 1% of developed countries' GDP goes to wasted medical error. So certainly a lot of business opportunities there. And so we're so excited to award this because of the improvement that it offers to patient communication, to providers, and to family, to Proxie Health. So congratulations to them.
All right, Proxie Health, are you here? Oh. Making their way to the stage. All right, congratulations. All right. Now, next up is our Audience Choice Award. So this is the company that all of you voted for and selected as the best pitch for the day. And pleased to announce the winner of the Audience Choice was Proxie Health. Welcome back.
Nice to meet you, buddy. Okay.
Because I got Swiss cows.
Oh, I love it. I love it.
Absolutely. All right. Well, last and certainly not least, the judges had quite a discussion back there as they talked through all the incredible companies that pitched today. And our grand prize winner is Augmental. Okay, Augmental. Here they come, making their way through the crowd. Oh. All right. Congratulations.
Thank you so much.
Yeah,
Thank
there
you.
you go.
Thank you.
All right. Let's just smile. All right. Well, congratulations once again to all of the companies that participated, pitched. Congratulations to Augmental, to Proxie Health, and everyone else that was here. I want to once again thank you to our judges. Thank you to our sponsors. Thank you to Paul. Please give a big round of applause for Paul. Thank you for being a host and keeping us in line. Thank you to Established who helped put all of this event together for us. And thank you to all of you for being here and participating. Have a great rest of your CES.